how it affected your mind, but it certainly gives us a different lens to look at the type of reporting the High Wire has been doing. When we look at this pandemic, so many things not adding up. You know, whether it's a mask that doesn't seem to work at all, no discussions being had about the dangers and all the death and injury from the lockdowns themselves, killing far more people than the virus ever dreamed. And what happened to cancer? What happened to heart disease? It's like, you know, my own cleaning lady at our house said the other day, you know, it seems like heart disease is gone, cancer is gone. It's just COVID. There's only COVID. It makes no sense, folks. And so I really think we do have to wake up. There is an audio recording that is going around that, I mean, just based on what we just heard, I want you to hear this now, whether you've seen it online or not. This is a city council meeting taking place in Edmonton, Canada. They believed that it was private, but it's been shared all over. And once again, we know that there's tens of thousands, if not hundreds of thousands of doctors, scientists, virologists speaking out against this pandemic. I'm being attacked. We're going to talk about the fact that there's articles now being written about the High Wire. There's even a peer-reviewed study in a medical journal that's been done to attack the High Wire and the work we do here, as though somehow we're spreading misinformation. Just like James Corbett said, we provide you with all the details, all of the links to everything we're talking about so you can do your own research and come to your own conclusion. Listen to the conclusion that is coming from the mouth of literally a world-renowned, important scientist named Dr. Roger Hodkinson, MD, CEO of the Western Medical Assessments, medical degree from Cambridge University, Royal College certified pathologist. Listen to him weighing into this private meeting, I guess a Zoom call in Edmonton. Listen to this.
What I'm going to say is lay language and blunt. It's counter-narrative. And so you don't immediately think I'm a quack. I'm going to briefly outline my credentials so that you can understand where I'm coming from in terms of knowledge base in all of this. I'm a medical specialist in pathology, which includes virology. I trained at Cambridge University in the UK. I'm the ex-president of the pathology section of the Medical Association. I was previously an assistant professor in the Faculty of Medicine doing a lot of teaching. I was the chairman of the Royal College of Physicians of Canada Examination Committee in Pathology in Ottawa. But more to the point, I'm currently the chairman of a biotechnology company in North Carolina selling a COVID-19 test. And you might say I know a little bit about all of this. The bottom line is simply this. There is utterly unfounded public hysteria driven by the media and politicians. It's outrageous. This is the greatest hoax ever perpetrated on an unsuspecting public. There is absolutely nothing that can be done to contain this virus other than protecting older, more vulnerable people. It should be thought of nothing more than a bad flu season. This is not Ebola. It's not SARS. It's politics playing medicine, and that's a very dangerous game. There is no action of any kind needed other than what happened last year when we felt unwell. We stayed home, we took chicken noodle soup, we didn't visit Granny, and we decided when we would return to work. We didn't need anyone to tell us. Masks are utterly useless. There is no evidence base for their effectiveness whatsoever. Paper masks and fabric masks are simply virtue signaling. They're not even worn effectively most of the time. It's utterly ridiculous seeing these unfortunate, uneducated people, I'm not saying that in a perjurative sense, seeing these people walking around like lemmings, obeying without any knowledge base to put the mask on their face. Social distancing is also useless because COVID is spread by aerosols, which travel 30 meters or so before landing. And closures have had such terrible unintended consequences. Everywhere should be open tomorrow, as was stated in the Great Barrington Declaration that I circulated prior to this meeting. And a word on testing. I do want to emphasize that I'm in the business of testing for COVID. I do want to emphasize that positive test results do not, underlined in neon, mean a clinical infection. It's simply driving public hysteria, and all testing should stop unless you're presenting to hospital with some respiratory problem. All that should be done is to protect the vulnerable and to give them all, in the nursing homes that are under your control, give them all 3,000 to 5,000 international units of vitamin D every day, which has been shown to radically reduce the likelihood of infection. And I would remind you all that using the province's own statistics, the risk of death under 65 in this province is 1 in 300,000. 1 in 300,000. You've got to get a grip on this. The scale of the response that you're undertaking, with no evidence for it, is utterly ridiculous, given the consequences of acting in a way that you're proposing. All kinds of suicides, business closures, funerals, weddings, etc., etc. It's simply outrageous. It's just another bad flu. And you've got to get your minds around that. Let people make their own decisions. You should be totally out of the business of medicine. You're being led down the garden path by the Chief Medical Officer of Health for this province. I'm absolutely outraged that this has reached this level. It should all stop tomorrow.
You know, if it was just one man, one voice, one doctor, one scientist like that speaking out, okay, maybe he's lost his mind. But the Great Barrington Declaration shows us that we are reaching, 100,000, if not more, scientists and doctors around the world saying the same thing. And these are top. This guy is not just some doctor in a small town clinic. This is a man that is got a company putting out the very tests, and he's telling you they are complete bull crap. You must stop using these the way that you're using them. Folks, I don't know what it's going to take. We have 9 months of the High Wire here, 4 or 5 episodes per month. So what is that? 45 episodes of scientists just like that telling you that. Studies telling you all of those things. And yet, are you still going to be afraid to stand up and do something about it? Are you still going to adhere to it?